Tensys Medical is a leader in the field of non-invasive hemodynamic monitoring. Our mission is simple: bring years of innovation and discovery to the patient's bedside and allow continuous hemodynamic monitoring without a single needle stick. Our latest platform is the TL400, a non-invasive, beat-to-beat, continuous advanced hemodynamic monitoring system. Utilizing a non-invasive sensor, the TL400 accuracy is clinically equivalent to an A-line, continuously displaying advanced hemodynamic parameters with a high-fidelity arterial waveform. Setup is easy. Begin by ensuring the monitor is powered, the bracelet is connected, and displaying the TL400 ready screen. Applying the bracelet to either the left or right wrist is as follows. First, apply the wrist splint to provide adequate wrist extension. Next, palpate the patient's radial pulse. Draw a line connecting the arterial pathway. Next, apply the adhesive-backed frame, careful to line up the printed and drawn lines. Ensure a sensor is properly connected to the bracelet. And finally, apply the bracelet to the wrist frame and gently snap the bracelet into its locked position. The TL400 will automatically move to the optimum position above the artery. During this auto-calibration, the monitor will display locating artery for a period of 3 to 5 minutes. In order to display accurate data, the patient's height and weight must be entered. This is done so by using the touchscreen interface on the monitor. If a provider would like to match the displayed data on the T-line to either a blood pressure cuff or other invasive arterial line, the provider will again use the touchscreen interface and dial in the matching mean arterial pressure. One important feature of the TL400 is the ability to show data trends over a 12-hour period. To display the trend, one simply pushes the trend function on the screen and can decide on the desired time frame to display. To return to the main menu, the provider simply presses the appropriate main button. To display advanced hemodynamic parameters, the provider simply pushes a button, and once confirmed, the monitor will display advanced parameters including cardiac output, cardiac power, contractility, stroke volume variation, pulse pressure variation, and systemic vascular resistance. For a quick snapshot of the patient's hemodynamic parameters, we have developed HemoPath, visually demonstrating the patient's data within a designated range of values. From across the room, a provider can easily assess the patient's hemodynamic status. To end the case, the provider simply pushes End Case, and the bracelet is carefully removed along with the wrist frame. The TL400 from Tensys Medical, leaders in non-invasive, continuous hemodynamic monitoring.